Hello, and welcome to the third Clinic Prep training video, covering how to monitor class performance in CyberPatient's 3 assessment tools, the Integrated Intelligent Tutoring and Scoring System, or the IITS, formative assessment, and summative assessment. This tutorial is applicable to both admin and faculty accounts. Once your class is set up, you can begin monitoring class performance. When opening your class, you will see course student statistics. You can review the class performance as a whole. The drop-down menu allows you to select the average or choose a specific case. The student list will show students in the class, and their best score is indicated by the red circle. Use the check marks to isolate students based on how many attempts they made. Click on a student to review their individual performance. The performance snapshot will show their score per attempt and their score compared to a class average. Click on Feedback and then See Details for an in-depth review of an individual student's performance. We are now brought to the CyberPatient's Integrated Intelligent Tutoring and Scoring System, or the IITS. The IITS calculates students' results based on 3 indicators: knowledge score, time, and the cost of care. These indicators are individually broken down in each section as well. As hospitals and textbooks are not able to provide this detailed level of documentation, this is a key benefit to CyberPatient. If we open the History Taking tab, we see the 3 indicators: knowledge, cost, and total time. Clicking on Feedback lists the questions the student chose compared to the gold standard already identified in the IITS. Questions are identified based on relevancy, and students only receive points for questions that are most relevant. The score here could be improved as the student did not ask enough most relevant questions. Asking about the financial situation was less relevant. To help students in their next attempt, the right section features the most relevant questions. You may also review the student's patient chart. The patient chart is not a required or scored component, but is up to you, the faculty member, to determine how important the completion of the patient chart is for your classroom learning objectives. You can export the chart as a PDF or print it out. Students have access to all this data. Although the cost awareness is based on Canadian hospitals and will vary in each country and each hospital, this feature is used to show students how their decisions, such as ordering unnecessary exams, can affect the costs to patients, hospitals, and healthcare systems. Once a student's performance is reviewed, faculty can provide customized formative assessment. Click back to the feedback page and submit your formative feedback here. The third assessment capability on CyberPatient is the summative assessment. This is administered only once the class period has ended. To administer summative assessment as an admin account, go to the student list, select the student, and then View Summative Feedback. From here, you will see the criteria established when creating the class. Now you select the criteria that the student has met, choose to pass or fail them, and leave some final comments. If the student passed, a customized completion certificate will appear under View Certificate. The logo can be customized to your institution as mentioned in the Account Management tutorial, video 1 of this series. To administer summative assessment as a faculty account, you can start at the dashboard and select the appropriate class under the student list. You will then follow the same steps mentioned before. This brings us to the end of our Clinic Prep training session. For more helpful tips and tutorials, go check out our Help Hub. Thank you for using CyberPatient as a tool to enhance healthcare education and bring the clinic to the classroom. Good luck and happy teaching!